Thank you. Member for Ryde, thank you.
Thank you very much, Speaker. I'm delighted to support the motion from the member for Holsworthy. And before I start, I'd like to, in fact, acknowledge and congratulate the member on her appointment as the Shadow Assistant Minister for Health. I think that that is a well-deserved appointment, and it's very appropriate that the first motion that she brings in that role is, of course, about health. And there can be few more vivid examples of a government's capacity to deliver for a community than by the way it treats its most vulnerable, its sick and its needy. And that is, of course, what the health system is about. That is why we build hospitals, that's why we look after and invest in a workforce, and that is why we always make sure that we are looking to the future. Politics is about the future, and so I'm going to make a prediction that is that for the remainder of this debate, those opposite are going to stand up here and look in the rear-view mirror. That's all they've ever done. Ever since I've got here, all I have heard from those opposite is reflections and backward looking, talking about the past, talking about what happened 15, 16 years ago. But you know what they haven't done? They haven't stood up in here, not once, and talked about a vision for the future. Not once. We are now more than halfway through this term of Parliament, and they are still occupying a vision backwards. Well, let me tell you something. I'll take that interjection.
Can we just stop the clock for a minute, please? Too much noise to my right. A number of you are close to it being on a call, so I'd be quiet if I were you. Thank you.
Thank you, Speaker. I will happily take that interjection. So arrogant were those opposite that they had the candidate for Ryde turn up in a caucus meeting believing that they had won the seat. So arrogant were those opposite that they put it in the bag before they had even concluded the count. And here I am, and here they're not. So let me say this, bring it on, because I welcome and relish the opportunity to bring you on, because you haven't got a hope. That was your chance, you blew it, and you know what? I'm more confident in the position because since I've been here, I've been waiting, thinking the time's going to come. But they are still, as I said, looking backwards. Not once have they talked about health in Ryde. Not once have they talked about how they're improving education. Not once have they talked about transport. But the motion is about health. It is important that I stay relevant, and so I will. I have a very important health facility in my electorate, Ryde Hospital. It's the place that I was born. It's precious. It is one of the most beloved institutions in Ryde. And thanks to the former government's investment, it is undergoing an extraordinary redevelopment. What was $479 million that has now been extended by a further $47.8 million, taking the total investment to $526.8 million. This will be revolutionary for Ryde. This is going to make sure that we can accommodate the growth that is coming in this community. It will make sure that we get the services that we need and make sure that a very old facility is brought into the 21st century. But those opposite have failed. Have failed to future-proof this hospital. This motion is about health inflation. It's certainly in its second part. And whilst I acknowledge and am grateful for a minor additional tipping in of funds, the $47.8 million that I alluded to, which of course was needed to keep up with that inflation. What they didn't want to tell the community of Ryde is that they were at the same time not proceeding with the maternity services that were previously understood to be restored at the hospital. So on the one hand, they're standing up, taking credit for the additional funding, and no one criticises that. That was always going to be needed. But what they are not being honest about is the stripping away of an actual service, a maternity service, forcing people to travel, often in peak hour, in excess of 45 minutes to Royal North Shore. That is not good enough. And I will make this point very clearly. In Ryde, we are undergoing extraordinary transformation, one of the fastest growing communities anywhere in the city. The suggestion that women need to travel in order to give birth in a community that is in and of itself worthy of its own maternity hospital is a disgrace, and you should apologise to my community. But it goes on, because elective and emergency services numbers are not heading in the right direction. For all their talk about how they've turned and revolutionised the health system, it is going backwards. Right now, as of the last reporting period, we are seeing elective numbers at 423 people on the list. Is that a decline from when they took office? Absolutely not. In fact, it is a 31.8% increase in the number of people awaiting elective surgery. Why don't we talk about emergency surgery? They want to crow about this. I asked a question in question time about this. The Premier stood up and took credit for how he'd fixed the system. As of today, the percentage of people that are being seen in under 4 hours has declined by 2.6%. The numbers are going in reverse. You're a complete and utter joke. Get your eyes off the rear vision and look to the future.
Okay.